If you've been trying to conceive for a while now, you may have asked yourself this question a few times. Am I having sex when I should? You may have even timed sex on the 14th day of your cycle because every article and video you've come across seem to mention that the 14th day of the cycle is the day of ovulation. Yet you still experience a bit of delay with getting pregnant. My name is Stephanie Nyong. I'm a cycle coach who teaches women to understand their unique menstrual cycle and use hormones to their advantage, be it to prevent or achieve pregnancy and monitor the reproductive health. So in this video, I'll be teaching you the right time to have sex when trying to conceive, which is your fertile window. Now, the fertile window is made up of 6 days, 5 days before ovulation and the day of ovulation. This is when you should be having sex if you want to get pregnant. Simple. You're only fertile for 6 days in your cycle. And why is this so? This is because the sperm can survive in the uterus for up to 5 days. Most women are very anxious to know the day of ovulation and have sex, in that day. But do you know the best time is actually before ovulation? So there's a sperm there waiting as soon as the egg drops, because your chances drop significantly after ovulation. Now, your chances increase as you go along the fertile window. So if you've been tracking your cycle before now, you should know when you ovulate. When I say tracking, I don't mean the regular period apps that ask for just the day of your last period to track ovulation. I mean tracking with your cervical mucus, what we call vaginal discharge, ovulation kits, and temperature. If you know this, then it's easier to count 5 days backwards to have an idea of your fertile window. Maybe you have no idea when your fertile window is. I'll be explaining how you can determine yours shortly. So before we start, you should know that it's important to have sex every other day in your cycle when you can, not just waiting for when you ovulate. This will help with bonding in your relationship. Bonding is important, so baby making sex doesn't feel like work. Another thing to check off your to-do list, it also helps the quality of the sperm when a man has sex more often. So let's get to it. The first sign to look out for is your cervical mucus. To get pregnant, you need to have sex more frequently as you begin to see the fertile quality cervical mucus. So when you begin to see wet cervical mucus, it means your fertile window is opening. At this stage, you can begin to see the cervical mucus like lotion.
Some will call it creamy. This is a menstrual cycle chart where a woman records her daily fertility signs and also times sex. So at the top here is cycle day 1, 2, 3. That's day 1 is the first day of your period, the first day you bleed. For cervical fluid, you can see it's dry, becomes sticky, and then when it gets here, you can now begin to see the creamy as the fertile window opens. Creamy is like lotion. So when you see this type of cervical mucus, you should start having sex every other day. So you can do 1 day off, 1 day on, 1 day on, 1 day off. See, these icons are to show the days in which she made love. So she had sex on the 12th day of her cycle, took a break on the 13th, had sex on the 14th day of her cycle, yeah? Then as you move further, you see that you begin to have a much wetter type, which is the most fertile quality cervical mucus, that is egg white or watery. Some people will say slippery. Right now, when you begin to see this kind of cervical mucus, you begin to make love at least once every day. Now, here where she notes the days in which she has sex, you can see that she's having sex every day on the 16th day, on the 17th day, on the 18th day, and even the 19th day. So this lady's ovulation in this particular chart was the 17th day, according to other fertility signs as well. I won't be going into that in this video. I just want you to know when to time sex. On the days where she had egg white and watery, she made sure that she made love every day, at least once a day. This is how you maximize the fertile window. And when you begin to see egg white or watery cervical mucus, it means that you are very, very close to ovulation.
Like most women, you may be confused on how to check your cervical mucus or even differentiate between fertile and not fertile cervical mucus. I have a very short ebook explaining the 3 primary fertility signs and how to use them to track your ovulation correctly. Link will be in the description or just below this video. Next, I'd like to talk about the ovulation test strips. These are at-home tests that tell you when you're about to ovulate. Unlike many people think, having a positive ovulation test does not mean you are ovulating on that day. It simply means you'll be ovulating soon, in the next 12 to 36 hours. As you begin to have fertile quality cervical mucus, you will see that you begin to see two lines on the strip. The test line very faint, right? It means that LH is rising. LH is a luteinizing hormone, which causes ovulation. You should have sex every other day as well as you begin to see this faint line, right? But as soon as you get a positive test, which is two very dark lines, both the test line and the control line, you want to increase lovemaking to at least once a day until you get a negative test.
As you can see right here in the menstrual cycle chart again, this is the row for OPK, that is ovulation prediction kits or ovulation test, and this is where the results are recorded. Now you can see that you have negative on day 12 of her cycle, negative on day 13, and day 14 and 15 it is high. So as the LH hormone rises here, you see in your test strip that you begin to have a faint test line, right? So it corresponds to your discharge as well, which is creamy, getting close to ovulation but not ovulation yet. And on the day she has egg whites, the next day she has egg whites and a bit of watery, you can see that the OPK result says positive. After which it goes back to being low and negative on day 18 and 19. Now you can see that while it is negative, getting high, she's having sex one day on, one day off, just so a sperm is there and waiting at the time ovulation happens, right? That's the reason why you have to have sex using this method. Now, on the day where she has egg white watery is positive, and you can see that she begins to have sex at least once every day until it becomes negative again, and she ovulated on day 17. So she very well took advantage of her fertile window. Now, this is why charting your cycle is very, very important.
Whichever of these two signs you decide to use, they can only tell you ovulation is approaching, not that it has happened. Now, many times there are cases of failed ovulation. Ovulation almost happens, but it doesn't happen. It is very common in the case of women with PCOS. How do you then confirm that indeed ovulation has happened? With your temperature. This will also help you know when to take a break from lovemaking. So it's best to continue daily sex from when you have the most fertile quality cervical mucus and positive ovulation test until you have had 3 raised temperatures. That tells you for sure that you have ovulated. Other signs tell you you are about to ovulate, but 3 raised temperatures tell you that you have ovulated and maximized the fertile window.
And as you can see from her chart right here, on the 3rd day post ovulation, when she confirmed her 3rd raised temperature, she didn't have sex that day. She just decided to take a break for a few days.
Using a cycle chart like this to track your fertility signs and time sex right is key and very important when trying to conceive, especially if you want to get pregnant fast. So links to download your menstrual cycle chart and other helpful resources to help you begin charting your cycle are just below this video or in the description. Next week, I'll be talking about signs that could mean that a woman is not ovulating. You don't want to miss that, so click the subscribe button, drop a comment, and share with a friend if you found this helpful. Thanks for watching. See you next week.